A headache can feel like just a nuisance, but sometimes it's your body's warning light. Not every headache has the same cause. Some are harmless and easy to fix, while others signal something serious. Let's dive into 5 surprising causes of headaches, starting with the most harmless and ending with the one you never want to ignore. Number 5. Dehydration. The simplest cause is often the first, being thirsty. Your brain needs fluid to function properly. If you don't drink enough water, your brain can shrink slightly. This pulls on the membranes around it and triggers a dull, throbbing ache across the entire head. You'll usually feel thirsty, have dry mouth, tiredness, or dark-colored urine along with the headache. The good news is this is easy to fix. Drinking water often clears up the pain within minutes to hours. It's the most common, least worrisome cause on our list. Just remember, even mild dehydration can give you a headache, so sip water throughout the day. Severe dehydration can cause faintness or confusion, but those are rare if you treat it early. Number 4. Digital eye strain. Staring at screens all day can surprise you with a headache. This happens when your eyes get tired or dry from too much computer or phone use. You might notice blurry vision, sore eyes, or neck and shoulder tension alongside your headache. The pain usually feels like a steady ache or pressure behind the eyes or across the forehead. Poor lighting, glare on the screen, or an outdated eyeglass prescription can make it worse. This type of headache comes on gradually after a long workday and goes away if you rest your eyes. It isn't dangerous, but it can hang on if ignored. The fix? Take regular breaks. Look away every 20 minutes, adjust your screen brightness, and make sure your eyesight is up to date with the right glasses. Number 3. Jaw clenching, or temporomandibular joint disorders. If you grind your teeth at night or tense your jaw when stressed, that can trigger headaches. The joint in front of your ear, the temporomandibular joint, and the muscles around it connect to your head. When they're overworked or irritated, you feel it as pain. You might wake up with a headache in your temples or behind your eyes, along with a sore jaw or even a clicking sound when you chew. Chewing gum a lot or eating tough foods can also set this off. Often people don't realize their jaw is the culprit. It's not life-threatening, but it can be chronic and painful. Solutions include using a mouthguard at night, doing jaw stretches, or getting stress management therapy. Your dentist can check for temporomandibular joint problems if your headaches keep coming back with jaw or ear pain. Number 2. Very high blood pressure. Most headaches aren't caused by high blood pressure, but if your blood pressure spikes extremely high, you can get a headache from it. This is typically a throbbing pain on both sides of your head. You might also feel dizzy, have nosebleeds, or see spots. It usually happens if your blood pressure jumps to dangerous levels, like 180 over 120 millimeters of mercury or higher. The pain slowly builds and can last hours or even days. In medical terms, it's a sign of hypertensive crisis, a true emergency. The headache itself isn't what hurts you, but it warns you that your brain's blood vessels are under too much pressure. If you experience this headache with a very high reading on a home blood pressure cuff, it means go to the ER. Doctors will carefully lower your pressure in the hospital to protect your brain and organs. The takeaway: don't ignore a pounding headache if you know your blood pressure is extremely high. It's much safer to check it and treat it than to guess. Number 1. Brain bleed, subarachnoid hemorrhage. The number 1 cause is the scariest: bleeding in the brain from a burst vessel, often due to an aneurysm, a weak spot in an artery. This causes a thunderclap headache. Patients describe it as the worst headache of my life. It comes on in an instant, reaching full intensity in seconds. You might feel it as a sudden, excruciating pain that wraps around your head as if something inside exploded. Often it's so severe that it makes you collapse or vomit right away. There's usually no prior warning. You may have been fine a moment before. Other signs include a stiff neck, sensitivity to light, confusion, or loss of consciousness. This is a life-threatening emergency on par with a heart attack. The bleeding cuts off blood and oxygen to brain tissue. Every minute counts. Without immediate surgery or treatment, brain cells will die. Sadly, many people don't fully recover from this even with quick care. Each of these 5 headaches feels painful, but they range from mild and fixable to dire emergencies. A day without water or a long stretch of screen time can give you a bad headache that usually clears up on its own. But if a headache hits all at once with crushing force or comes with worrying symptoms, like vision trouble, fever, or a stiff neck, it could be the start of something far more serious. In those cases, especially the last two, seek medical attention immediately. After all, it's better to have a harmless headache and find out it's nothing than to have a dangerous one and ignore the warning signs. Thank you so much for watching. If you enjoyed the video or found it useful, feel free to like, share, and subscribe for more content.